Everyone, you have tuned in to the Board of County Commissioners work session for Tuesday, August 2nd. It's just about 11:35, and we're going to start with a citizen board interview for the Citizen Grant Review Committee, and we have Mitzi with us and Martha Campbell. So welcome, thank you for being here. We all have our name tags. I'm pretty sure you may know Patty Clapper, Rachel Richards, Steve Child, and George Newman. Michael Owsley's not with us today. And I'll lead off just to make it easier. But if you would like to tell us why you would like to serve on this committee.
Sure. Thank you for having me. I would say it's kind of multi-pronged. One thing is I just would like to get more involved in the community, and I think this is a great way to get a very in-depth understanding of different organizations that are operating here, and kind of how they, there's an ecosystem of nonprofits that help develop this community into what it is. I think, we're really fortunate to live in a place where there are, pretty substantial amounts of wealth that can be directed towards such initiatives, and I'd love to kind of, take my experience and my perspective on, development in community, and kind of apply that lens to, to vetting some of these different applications. So those are kind of the high level reasons for why I'd like to be involved. I also have a personal interest in economic and social regeneration of communities as it relates to using not just the built environment, but how resources are allocated to different organizations that help kind of stimulate that kind of development. So for me, this kind of nicely aligns with some of my own personal career goals. So those are kind of the three of them in a nutshell, but I'm happy to take any questions you might have about those reasons.
Okay, Patty?
Time commitment. I'm sure Misty's already told you that we're gearing up. When's the due date? Today? Today.
Actually, yesterday. Yesterday was the due date by close of business, but I say today because at the office we're very involved right now in getting the master binders ready with all of the grants for printing. And then we roll out to the committee on the 11th.
So this one committee has their year's worth of work packed into the next couple of weeks. So which some people really like because then they get to be involved in depth. And so we just want to make sure that anybody who we're interviewing an interest to appoint to this committee, that they're aware of that compact time frame, and that will work with you.
Yes, that was communicated to me in the application process.
And on a side note, I want to congratulate you for being the captain of the lightweight crew at Stanford University. I am extremely impressed, especially after reading Boys in the Boat.
Oh.
And on top of that, my niece rose crew for SMU.
Oh, really? Okay.
We'll talk about it.
Okay, sounds good.
Very good. Steve?
So Martha and I were visiting. We both are graduates of Stanford, but did you have to run the stadium steps
I did.
as a crew member?
I did.
Because that was a big thing when I was there.
Yeah, and I guess they've, sorry, that's my phone. I
Okay, we'll ignore it. You ignore it.
They have redeveloped the stadium, so the layout's a little bit different from, what you and I used to have to run. But yes, I definitely did that and had some moments where it didn't feel so good.
So looking through your resume and knowing you work at RMI, and I've actually read the Fort Collins report that you are a co-author of. So you have a really great resume and have had lots of different experiences. And I think that all would be helpful in serving on this board. So thank you so much for applying for it.
Yeah, thank you.
George?
More of a question for Mitzi. So this spot is open just for 1 year. It's just filling in, and then,
Correct. Yeah.
and then it would be open again for reapplication for a 4-year
For the
stint.
4-year term, correct. This is replacing Robin Van Domelen, and her term is up April of 17. So So if appointed, Martha would serve in that role and finish out that term, and then, yes, come back, I believe, to reapply for the regular slot for 4 years, yeah.
Okay,
So we're
good.
gonna make her, love it. She'll love it the next 6 weeks. If you appoint her. I know, I'm
Don't worry,
speaking out
don't-
of turn. I
No,
know,
no, no,
but
no, no.
yes,
It's a good way to
that
get
is
your,
what's
get your
happening.
feet wet.
That is what's
Huge
happening.
commitment at this point.
Yeah.
Great, thank you.
Yeah, well, I think it's the first year you kind of get your feet wet and get to
Yeah.
understand these, and the second go-round, you're just that much more experienced, similar to serving on any board. So we'd love to have you there for the long term if that's the appointment. And do we have any other applicants we need to interview?
No, with this, we will be fully loaded on the committee.
Okay,
And then we'll just, have to look at youth again for next year, because these 2 youth are seniors, and they'll be rolling off after this appointment, but.
okay. Very good.
Well, I think we will probably discuss this in an open discussion, because we kind of have a little time frame here.
Awesome, good,
Yep,
good.
yeah. And do you have any questions for us?
I guess, I guess just love to get a sense of this. This is somewhat new, right? I guess it was created in 2011. The resources were allocated for it. That's what I thought I
No,
read on the
that was the
website.
most recent reauthorization of the ballot question.
Reauthorization, okay.
It existed before, and the citizen review panel existed before as well. And I was going to say, if anything, this is a challenging job because there are unlimited demands and limited resources. And so it comes down to hard choices, and that's the challenge of looking at a lot of really worthy projects and saying, can only give you half or 3/4 or whatever of what you would like to do. But no, it's the citizen review panel has been established for a long time.
Yeah, the Healthy Community Fund actually has been established since 2002. And it's been voted in, every 6 years, it's been voted again by referendum by the citizens for 6 years.
Okay.
And we'll be going back again for a vote either next year or the year after that to see about extending.
And are there strategic priorities that are set for how those funds? I mean,
Yes.
she kind of informed me a little bit on
Yeah.
these like broader categories.
Yes.
But are those decided kind of by the community or by you all, or?
Those priorities that were stated in the most recent ballot questions did come from polling the community, but there aren't hard and fast ratios of who gets what other than the senior center.
That's right.
Senior
Who gets
services.
A proportion, a percentage of the fund for their base funding from the Healthy Community Fund.
Yeah.
But far and away in the last polling, safety for family and youth really came out on top. So family and youth well-being services are really high
Yeah.
on the list of things we do.
And we would be the first to say there's at times overlap between different services that organizations offer, but so we're trying to avoid duplication, but not so much that it's siloed. We understand that there some overlap is appropriate,
Right.
be the best way to say it. Well, if there's no other questions, we'll say thank you very much. We'll discuss it this afternoon and get back to you as soon as possible.
Great.
Thank
It
you
was a
very
pleasure
Okay,
to meet
and
you
just
all.
block off those 3 days that Mitzi's given you, okay? Thank you very much.
Thanks, Martha.
Okay. Next, we're going to go on to the budget supplemental request from Phyllis Matthijs, and this is on the Pitkin County paging services.
Pitkin County has been in the paging services business for quite a while, and it's expanded and grown, and different agencies have been using it without a real consolidated big picture look at it. So this is an infrastructure request of $47,316 to purchase an interface that will work with our dispatch system, a single point of contact and a single point of communication. Pagers, it's alphanumeric pager, one-way communication system like the pagers we used to wear years ago. And they service where cell does not service. And right now, the outside agencies that we serve includes Aspen Valley Hospital and they pay a fee to us annually for that service, as well as Aspen Utilities, and then the sheriff's office has some, facilities uses it. Our business information technology staff has one for on-call, so that's typically how they're used, so people can be reached easily with a single alphanumeric message that comes to them. We tried to look at different ways of repairing what we had. There was a solution that was attempted a couple of years ago, but it required so much work by the dispatchers, and it had multiple translations through the system, because the messages can also go to your cell phone for people that did get cell phone reception. But messages were getting lost, and you couldn't tell between how many times it went from the dispatcher into one system and then it was translated into another system, into another, and they were getting dropped, and you couldn't tell where the drop occurred. So this is a single comprehensive interface. It was reviewed by the communication board. They identified approximately $200,000 that's being saved this year through not having a dispatch director and some vacancies. So because of where the dollars are being spent and where it's being saved, it needed to be a supplemental request. It'll come out of the fund balance, but then it would be replenished by the savings that's there.
Okay.
And that's what the COM board directed us.
Any questions?
I have a question.
Patty?
So it's my understanding, once the system is in place and running, then the operating costs and et cetera will be paid by the jurisdictions that are using it.
Correct.
But they don't normally pay into the actual purchase, a percentage into the purchase of the piece of equipment.
Most of the users right now are the public safety agencies, which is why, so the COM board kind of oversees what happens in
Right.
dispatch. So that's why the purchase for the infrastructure is being made out of the dispatch budget, which the dispatch budget is then allocated to the agencies that use dispatch.
All right, perfect.
So that's how,
But it is in a different way.
Right.
Okay. Yeah, I think we need to move forward with this.
Okay, everyone, nod aheads. Steve, you have a question?
Yeah, one more question. I'm trying to see how this would work if somebody's paged. Then with the 800 megahertz system we're putting in, some people would actually radio in, or would they phone in, or how would they typically use it?
any way, shape, or form. If they are in radio coverage, they could just radio in. If they're using a pager, they're probably not in cell coverage, so once they hit cell coverage, they would call in. So it is a one-way. The dispatch doesn't know if they're responding until they make contact back in. But I believe that's how, there are the doctors at the hospital, same thing, they know once they're paged. This is a much more definite program that'll work.
And then I was just going to ask about the length of it in a sense. I have no idea when we'll be able to have fully accomplished our broadband and cell phone service expansions. But are we locked in for 20 years or?
No, this is just the interface and the infrastructure. It'll have an annual maintenance fee, which I believe is about $2,000 a year. So we can stop our maintenance at any time. And I believe the life cycle of this is between 6 and 8 years. So hopefully within 6 and 8 years, maybe we'll be somewhere different in broadband and cell.
Okay, that's all I was wondering.
Yeah, so
Okay.
it has a life cycle that hopefully will get us through to the next generation of communication systems.
Okay. Everyone supportive of the supplemental? Great. We'll see it formalized then on our next regular meeting. Thank you, Phyllis, for your work on that.
Thanks, Bill.
Let's see, what time is it?
10 minutes till.
It's 10 minutes till. I think then maybe we'll have a 10-minute extra lunch, and everybody be back here at 1 o'clock for our special meeting with the Board of Health and Community Health Services Board. Thank you, Grassroots. Go off.
provide their best effort to move from clinical nursing services, direct services that they had been providing, and embracing the statutory requirements of population health. And what we have found is that it's very difficult for them to accommodate both the clinical nursing services and the demands for population health assessment. And in 2015, they have been funded through the Healthy Community Fund. They made a significant ask to the Healthy Community Fund to help them address rising costs in direct services, nursing services, and also address the pressure for population health, emergency preparedness, and that kind of thing. The Healthy Community Fund was unable to accommodate that level of an increase, and it ultimately sort of raised an issue that Liz and I have been dealing with for the entire time we've known each other, which is the structure that we've created in Pitkin County is unlike any other in the state. There are only 4 other counties that contract public health to a nonprofit, and the structure that we've created, we believe, has actually, ultimately threatens our ability to protect the public because of the confusion and the structure and the governance issues that we have contracting public health out to a nonprofit. So, there.
So as a reminder, the Keystone recommendations are listed here for you. Number 1 was to create a Pitkin County Public Health and Environment section and separating health and human services. So there would be a public health and environment section and a human services section. The recommendation was to hire a public health director along with 2 public health planners to start out with.
We've gone radio silent. Who? I've got it.
Yep.
I've got the power.
Yeah, just
Liz,
point
you
it
have
towards
the
yourself.
Okay.
You can just point
Bend it
right
when you
toward
need
Is
to.
it towards me?
Yeah.
There I am.
Thank you, Steve.
Okay. The recommendation also included that community health services would continue to provide these essential direct clinical services until a time at which either a better solution or those direct services could be integrated into the healthcare delivery system, if that's determined, and also to establish a new board of health with subject matter experts. That was the crux of the recommendations.
And what we were thinking was that you all got a copy of the final report. We spent over 2 hours with Keystone where they justified these recommendations. It's not our intention today to justify other than it really is about best practice and protecting the public as best we can and finding more efficient ways of providing the service within a structure that's more supportive than the structure that we have today. So,
And today is also not any sort of final decision day. This is a conversation.
right, so just a reminder that the Board of Health makes recommendations to the Board of County Commissioners. So what we're looking for today, if you're ready, is a recommendation to continue to pursue our recommendations through the budget process.
Okay.
Right, but the Board of Health doesn't make any fiscal decisions or...
And the budget process is for 2017, which you're perceiving as a potential transition year,
Yes.
but very much similar to what we have this year in terms of services and where they're offered.
Well, we're going to talk about that, so we'll get to that, what our recommendations are. So it's actually different.
Okay.
Yeah. Was recommending a phased approach because the change that we're trying to make by separating public health from community health services is dramatic. So they recommended that we have 3 phases at least, and then, who knows what phase 4 is, to be determined. But phase 1 is that happens now this summer and fall, where we start to plan the shift in structure. We move toward putting the costs of adding a public health division as a 2-year pilot project, basically startup funds in the budget, and that we plan for a start in 2017. So we've been working on job descriptions and the figuring out, working with the multidisciplinary team to shift from public health and human services, so a shift from my division, and also the shift from CHS. In phase 2, which would start in January, however soon we can get to it, we would look at hiring a director of public health and environment. And we use that term public health and environment because that's what Keystone calls it. It could be called anything we want, but we're just going to use the term that they're recommending. So the director would be responsible for really doing a direct service assessment. What kinds of direct services do we need? How should they be provided? Who should do them? We have the Public Health Improvement Plan that Jordana has already started and has to be done by the end of 2017. The strategic community conversations with partnerships around how do we build a more successful public health system, strategic planning with human services, developing an integrated plan for environmental health, because the recommendation is to bring environmental health into the public health section, and then ultimately starting to plan for the new Board of Health, which would be made up of subject matter experts. And then the second part is to hire the 2 public health planners that they're recommending that we need. And we'll talk a little bit more about that. So that would happen in phase 2 in 2017. And then as that public health director and the planners have done assessments, their public health assessment, we would move into phase 3 in 2018, which would be to establish a new Board of Health made up of subject matter experts that would advise the county commissioners, adopt the bylaws, and expand public health and environment staff based on the Public Health Improvement Plan or services, whatever services or staff, whatever's needed. And then finally integrating environmental health into the section as a final move, not maybe necessarily physically, but functionally moving them. So.
Can I ask a question?
Well, yep, Patty.
Where do the clinical services play in that phased approach? How do we?
Oh gosh, I have to go backwards. I don't know how to go back. Here we go. So really in here, this direct service assessment is, the ability for the Public Health Improvement Plan will be looking at direct services, we'll be looking at health from all angles. And the Public Health Director, along with Community Health Services, Mountain Family Health, all the providers, will have the opportunity to start looking at the landscape as it's changed in the last 6 to 8 years and look at efficiencies.
But until such time as we will continue to provide those direct clinical services
Yes.
throughout this phasing.
Yeah, and we
continue that care.
Right. So I think right. It's we have a proposal to maintain those clinical services. Keystone said they're essential clinical services. We need to maintain them, but it isn't necessarily. It doesn't necessarily mean that it's all done by community health or it's done with the model that we're using now. Okay.
Markey?
Just a quick question for you, Nan, was contained within that statement, looking at 2017, 2018, the direct services. What I would be somewhat interested in is what protection do we have for the staff who currently provide those direct services as employees? Because once they begin to hear stuff, they tend to start looking for other opportunities. So recruitment, retention, those types of questions I would be helped
Okay.
have
well,
answered a little later. Or
that would be
whenever.
good for the discussion part,
Okay.
I think.
Okay.
Yeah.
I think that's a
Thank you,
discussion
Marky.
that our board has brought up.
It's another thing to cue in when you talk about partnerships, which I think we need to look at with Mountain Family. just so everyone's aware, there's a transition going on with Mountain Family at the same time, and especially the key years will be 2017 and 18 for provision of clinical services, where they might have to actually decrease their opportunities to provide those services. So we need to keep that in mind as we're transitioning one, we're transitioning the other, and those two may not be in agreement.
Yes, there are a lot of elements at play. The health landscape changes daily.
And I might just add that in this transition period, I would consider community health services still under the umbrella of public health and still in this contractual relationship with the county until a time when it's decided that those services will be provided by someone else.
Right.
Or should they be continued with community health?
Or, right.
Yeah.
Exactly.
Yeah.
Right. So our multidisciplinary team, which was really made up of finance from both agencies, Human Services and CHS, and I mean the county and CHS,
And environmental health.
and environmental health. We really looked at, is this a recommendation that we think we should move forward with, and why? And I believe there was unanimous agreement that now is the time to do this. And the reasons being that, we've been in decades of discussion about this structure between community health and the Board of Health and Human Services. How are we best going to accommodate the needs for the essential elements of, and the mandatory elements of population health assessment? There's momentum because of Pitkin County and CHS staff and possibly the board, we believe, are in agreement that this is the best approach. The evolution of the Public Health Act has really given us the time and the space and the opportunity to get to this point today, where we had to step up and comply with the standards of the statute. We started with our own model, and over time we found that model isn't working. And now with the city of Aspen really taking a very courageous move and dismantling their public health agency, their public health director, and their Board of Health a year ago, we're in a good place now to really be looking at how do we do this differently. The Public Health Improvement Plan is due to be finished at the end of 2017. And so we have a great opportunity to really be assessing the health landscape through that tool. Both Human Services and Public Health are the workload for both of us in Human Services and all the pieces of Human Services and all the parts of Public Health are really outpacing our ability to keep up with the demands. We believe you have expertise at the table to help you with this transition, and we hope that our commitment and our energy to making this happen helps to ensure that this really is the right time and not to wait for someone else who has to figure all this out. We think we figured out a lot of it. And last and most importantly, this new structure that we're proposing, that we move forward with, is really about better serving the public and protecting them and strengthening our ability to respond to public health and environment emergencies, needs, trends, and growing demands. Do you want to add anything to that?
So some of you might remember this org chart.
How can we forget it?
Yeah, when we were going through trying to understand the implications of the Public Health Act in 2008 and 9, we had another multidisciplinary group that came together to try to understand what is the landscape of public health in Pitkin County. And you may remember Carla Osberg. She was the manager of environmental health at the time, came up with this great depiction of what public health looks like in Pitkin County. And granted, this includes a lot of community partners. You see all the nonprofit organizations at the bottom and the hospital. But the core of this org chart is the core of our structure. It illustrates the complex nature of our structure. So that's really just a visual
of the early chaos.
Yeah.
But then we moved to this chaos.
And so we streamlined it a bit. This was in adding, with the city of Aspen letting go of their public health department and allowing this to expand this board. This was an org chart that we presented to the last joint CHS board and Board of Health meeting in 2014, actually.
14,
so it was
yeah.
actually
Yeah, I
prior
see
to
that.
to the ending of the city of Aspen. But it looks a little cleaner. But again, lots of dotted lines, and with those dotted lines comes confusion and inefficiencies. So this is the proposed org chart for this new public and environmental health department, overseen by the Board of County Commissioners, with the public health the public and environmental health director reporting directly to the county manager. Board of Health has the oversight and makes those recommendations to the BOCC. And then under the public health director would be the local medical officer, environmental health, a couple of planners, and there's community health services still in that contractual relationship.
So can you hold up for that?
Yeah.
So where does community health, where does the board of CHS then play on this chart?
Well, as long as Community Health Services is a nonprofit, that the board would exist and would have to.
No, I
but
understand
they're
that.
not written onto the chart, but they would still exist and would
So-
just be supportive to the nonprofit.
So, but according to this chart, you'd have the public health director would be providing the contract with community health services, and I'm just trying to figure out where CHS comes, because one of these whole issues, I think, has always been the issue of governance, right? And so we're trying to get the governance model much cleaner. And so I'm still a little confused where CHS, the board, plays into this. I understand that they'll overlook you and you're as the director.
Oh, sure.
But in terms of policies or in terms of allocating resources, because CHS will still, I'm sure, be a recipient of the Healthy Community Fund.
Yeah. So, George, I think the way to think about it, at least the way that's been helpful for me to think about it, is community health services could potentially exist on its own as a nonprofit without a relationship with the county or the public health director and such. That obviously has some practical challenges to it. But as a practical matter, community health services exists as its own entity and chooses to enter into a contractual relationship, just as the county through the health department would choose to enter into a contractual relationship for the provision of services. So the community health board would remain in existence, as Liz said, so long as the nonprofit is in existence and would be providing the guidance and leadership and really the fiscal oversight for the nonprofit. And then that board would also be making judgments as to whether the contracts that we're entering into are beneficial for the nonprofit. I would anticipate there would still be the informal relationship, more of recommending things that maybe should be happening or not happening in the community. What the org chart here represents is that we would hold the public and environmental health director accountable for contracting those services that are necessary to deliver on the public health priorities. And so really the only relationship here, that line, is for those services that are contracted. Otherwise there would be no oversight or such. There's no real control from that public health director to community health services. I don't know if that helps clarify at all.
And John, so that I'm clear on this new org chart, it could be a contract for all services or just some services, or there could be more than one contract. There could be contracts with others to provide those services as well.
Yeah, maybe on future iterations we'll find a different shape that kind of represents. There's really a bubble of contracts, and those contracts could be with community health services. It could be with another provider, depending on where our public health planning brings us and who is in the best position to provide those services. And I think, that's kind of the governance lock we've gotten ourselves in, is who's making what decision when to comply with that Public Health Act. So we're trying to get out of that. I think as the Keystone report, spelled out, there are critical services being delivered by community health services right now.
In an excellent manner.
In an
I would
excellent
add.
manner. And there's also probably a scope of services, this is what we're struggling with, that we need to do better. And that's where this public health director needs to make decisions about allocation of resources and recommendations back to this Board of Health and ultimately to the Board of Commissioners.
Patty?
Yeah, and speaking of allocation of resources, good segue, thank you very much. When you talk about in our agenda item summary, it talks about the funds will be drawn from the general fund balance with the intention that the full cost will be absorbed within the Healthy Community Fund in 2019. So that would mean we'd be paying for staff members out of the Community Health Fund in 2019, hopefully, those 3 masters in public health that we're looking at hiring.
That's the intention. We as you all know, we fund senior services at 21% of the fund,
Right.
and it funds their staff.
Right.
So I'm going to talk about that in a minute because that's a really good question. Where does the funding come from?
Yeah.
Okay.
That's kind of a big concern when we're
Sure,
looking at
absolutely.
in the county.
Yeah.
Okay.
So we'll keep going. We can always come back.
Did anyone else from either board have a question at this point? Just let me know if you give me a little high sign. Okay, thank you.
So it was, Liz and I both found that it was helpful, and as did the team, to kind of break down what would everybody do. What do we do if we're not in this crazy structure that we have? So you'll see that we use county terms, mandated services and essential and desirable. So the mandated services are services we have to provide by law or statute, state, federal, or local statute. You'll see the human services list of all of the services that are provided in my division: protective services, economic security, veteran services, child support enforcement. The essential and desirable services are senior services, and then ESF is the emergency support function 6, which is mass care and housing and human services, and then any other grants that we get from the Department of Human Services. Public health, which would be our new section, would be responsible for the mandated elements of the Public Health Act: assessment and planning, communicable disease prevention and population health, emergency preparedness. You guys can see what's on here. EPSDT, early periodic screening, diagnostic and treatment, I think I have a typo there, is identifying young children who may have issues before they start school. And then we have essential desirable. The Board of Health knows we spend a lot of time talking about dental, substance abuse, mental health, access to care, other grants from CDPHE. So the public health director would take these things from the Health and Human Services Director, who is now just a Human Services Director, and we would have a really clear delineation of health and human services, which really hopefully will allow us to do the co-managing part, really find where we have alignment with the Healthy Community Fund, strategic planning alliances, and then the Child Fatality Review Committee, and other things for sure. Community health services would be providing the mandated service, which is women, infants, and children, WIC, it's a nutrition program, and the tuberculosis program, which is about surveillance and support for people who are end up with TB. and family planning, women's health, our essential desirable prenatal immunizations, and the sexually transmitted disease clinic. And then we have environmental health, because they're on the map now. They're part of the partner of public health. And they have their mandated services, as you can see, water quality, disease surveillance, monitoring, vector control, emergency preparedness. And they also have, in Pitkin County in particular, a whole bunch of essential and desirable functions. In particular, natural resources being a big passion of ours in Pitkin County, and trying to maintain that or build on that. Consumer protection, land use referrals, dealing with marijuana and all the impacts of that, and then air quality. For us, this was really helpful in sort of dividing the pie. What would it look like if it got a little bigger? How would we share those responsibilities?
Could I just add? Oh,
Yeah, please, Liz.
Yeah.
I was going to add that under the mandated services for community health services, I could foresee that at some point WIC and TB would go over to the county. WIC is typically offered in a county public health department. It's rarely offered in a standalone nonprofit, but at such a time that requires some, either an RN or dietitian to manage that program, as does the TB program. You need a nurse to sort of do some of that, the treatment and such. So, because TB really fits under communicable disease investigation. So in the long run, I could see those going under the county. And under the essential and desirable and the public health box, those, would change depending on what priorities arose from our public health improvement plan. So those would be, those would evolve based on what our plan says.
Okay, and then what I was going to ask is just to clarify, under environmental health monitoring, is that the restaurant inspections? Food.
Consumer protection.
Okay, so we have that as essential desirable, but so it's not mandated, but we do it. So
I
okay.
think it's disease surveillance, investigation, and monitoring. I'm sorry, that's all one line, and the monitoring.
Oh,
looks
okay.
like
So
it's separate.
that's what I was thinking.
Yeah.
It's pretty much mandated because we have that contract. And then the other question under human services, when you talk about economic security, that's where you have food security and individuals who are eligible for
Public benefits. Public assistance programs, Medicaid,
Okay.
Food assistance, old
Yeah.
age pension.
Just a quick little side note. I just came back from the National Association of Counties meetings in Long Beach, their annual conference, and they have all topics, from transportation and community health. And so there was a lot of discussion about how public health is changing, and that, is it everything now? Isn't it having a secure home and housing? Isn't that part of someone's health when it relates to their stress levels and other issues, and clean air, obviously, and things like this? But they're just nationally taking such a broader view of what defines community health now.
Yeah, and actually the social determinants of health, which really touch both of us, both public health and human services. And so the strategic planning together, really allows us to go beyond what we've been doing and really look at issues we haven't touched in a while, like housing, transportation, community building,
Moving out poverty,
seniors, all of those things, poverty reduction, exactly.
Thank you.
Right. So this is, our first attempt at what might it look like. And then Connie did a budget for us, and she's in the room to catch me if I don't do this right. But so the wages and benefits reflect the public health and environment director and the two planners to start. What you'll see there in green is the Board of Health officer. It's in green because it's already in my budget, so it's not new dollars and it's not counted in the total cost. We built a budget very much like the Human Services budget. I took my budget for Human Services Administration and basically overlaid it for public health. And so we added purchase services, public outreach, printing, education, and training. Those are all kind of standard amounts given the size of the section so far to start, travel, phones. And we also looked at $10,000 that's already identified in the budget for Health and Human Services remodel in the event that we have to change space to accommodate this. With the total expenditures in 2017 and 2018 not being that different because some of the startup costs are not necessary, the computers and the remodel. The revenues are a tricky part, and this is a projection. It's tricky because Community Health Services currently gets these grants. And it's just going to take some time for us to figure out what part, when, how much do we separate out clinical services and population health so that the county could get any of these grant dollars. And Liz is going to talk about the revenues. I'll let her do that. I just want to add that one of the planners in Community Health Services is half-time Eagle, half-time Pitkin. And so you'll see a revenue here of $32,000. That's from Eagle County. So we anticipate that to continue. And the other thing is the Healthy Community Fund contribution to CHS, which is down around like line 5 after revenues. We talked about possibly that $32,000 is the amount that we gave CHS in 2011, 12, I think, or 13. Started in 13. 11 was when we renewed the tax for a planner. So that piece is about possibly diminishing the Community Health Services amount that they get, and in order to build Pitkin County Public Health. We have talked about the Healthy Community Fund and the future of the Healthy Community Fund. It is sunsets in 2018, and so if we are to continue funding in 2019, we have to renew it in 18. There could be arguments for going in 17 because of the pressure with public health, because of the changes with physical health, mental health, all things health. There's a possibility for the Board of County Commissioners to consider going out early to ensure that we can continue to fund public health and the nursing services that are negotiated in 2019. So that's just something. So these are kind of earmarked amounts.
Yeah, on the emergency preparedness grant, do we really foresee them doubling that in a year? Because what I'm seeing at the Northwest COG level, we're seeing a downturn. We're seeing them starting to not fund our emergency preparedness, our homeland security grants as well as they have in the past.
What this represents is a half a year's worth of income because all of our state grants are on the state fiscal year.
Okay.
So that would be income.
Half year and a full year.
Right.
Yes.
So that grant for us is typically about $20,000 a year. So in 2017, you would get that grant starting in July.
Got it. So that makes sense. So looking down at a lot of the other things.
Right. So that's true of the OPPI, stands for Office of Planning and Partnerships and Innovation. That's the grant that funds public health planning, communicable disease investigation, child fatality review, sort of our basic public health grant. So that's half of that amount. Jordana also provides technical assistance to about 14 or 15 other Western Slope counties in the public health planning process. So part of her salary is subsidized by the state health department, so that's half of that amount. And as Nan already explained, the Eagle County contribution. So that's
That's good clarification. Thanks, Liz.
So what we're looking at is a total in 2017 of 267,706, and then that amount going down in 18 to 202,782. With the proposal of staff is that we take the 470,488, which is the combined 17, 18, and put it through the budget process, requesting it from the general fund balance, so that we fund the development of public health without creating too much chaos and change for community health services, for a period that we would call startup funds. And then with the hope that in 19, we're all clearer and we have a better understanding of the funding.
George?
So back to, I think, one of Patty's earlier questions or points. I mean, we're fortunate in this community that we have a healthy community fund, which is very unique, and our community has supported in the past, and hopefully they'll continue to support it. Community Health Services is a recipient of the Healthy Community Fund, and looking at the budget, you're saying that the intention that the full cost for the Public Health Department will be absorbed within the Healthy Community Fund in 2019. So that's a huge chunk. Last year we gave out about 1.7, 1.8 million.
Right, and it looks like we have about 2.1 million this year.
Right, and so my question is, as we are utilizing the Healthy Community Fund for some primary organizations, whether it be senior services, community health services, and now the public health, that's going to impact those other 70 or so nonprofits that rely on that little boost that the Healthy Community Fund provides them.
Right, so the primary way to continue to support the whole community is to increase the amount that we request, which we've done every time we've renewed the tax, to accommodate the growing demands. So we have a lot of due diligence to do. We do polling, we find out what is tolerable. You may remember that in the ballot question, immunizations and public health were part of the top 10 priorities in the ballot question. So we would go out and continue to pursue the right amount at the right time. But there's a possibility that the Healthy Community Fund funding will change. We've grown to 72 agencies. We really have to, Mitzi and I are spending time looking at going to Boulder, looking at how other counties are funding their agencies, and whether or not we can accommodate that many still is, we don't know. Things are going to change. But the nice part for us is that the public health director will be our partner in doing this, so that we will really be accommodating health needs and human service needs.
The other thing I read in the memo from Keystone is by dividing out health and human services, that provides more of an opportunity to go after some larger grants, whether it be federal grants or state grants, specifically for public health,
Right.
which we haven't done in the past.
That's right. In the changing landscape of healthcare, there's many Colorado health foundations are funding large initiatives, and so there's a lot of opportunity in the public health department to look for those kinds of dollars.
And that's not really noted in this budget.
No, we haven't. Yeah, because it's dependent on grant success. So we believe that there's a lot of opportunity for blending and braiding funds, is what Keystone calls it, what we all call it. We do it in human services, we do it in senior services, and so there's great potential, which could reduce all of this and make it easier for everyone. Thank you for bringing that up.
Yeah, and I'll get to Patty in 1 second. That's another question, but I think it is challenging for all of us when we're dependent on a constant renewal of a source from the public. And I'm sure many of you have assisted with that campaign in the past, doing some door-to-door or contributing to help print flyers out of your own pocket and things like that to be able to secure a successful ballot. And so that's something we'll have to talk about more carefully later. It may very well make sense to go out in a 2017 for the amount that's needed. It is a mail-in ballot, being an off-year election. Those would get a little trickier. But from there, we may look to ask, can some portion of that become a permanent fund? And so it's not part of an annual renewal that would support these activities as a service the county needs to continue to provide. I don't know what our default would be if there was a failed election. Obviously, if it was in 2017, we'd have one more year, a second chance, as it were. But to absorb these long-term into the general fund without a dedicated source would start to really impact other services of the county. And so that's a tricky challenge to present fully to the voters. But this is a long-term program. It can't go away. It's when you look at just the mandated, let alone the desirable services. So we'll have to have a lot more discussion about how to have a successful election and how to structure that. Patty?
Yeah, I think it makes great sense to, to fold environmental health into public health and to separate out health from health and human services. And I think that's really something we need to look at and support. I am really concerned, having been on the board during the recession when we had dramatic hits to our general fund, we had dramatic hits to our property tax increase, which lowered the amount that the Healthy Community Fund was able to bring in. The dollars went down. I'm really concerned about the addition of, at this point, 3 permanent additional full-time staff members for public health, and how we would fund that in the future. I mean, it's a significant hit to our general fund, and the county has huge issues hitting our general fund right now, and I think we need to be very careful when we look at the financial impacts of this and how we would support it years out. That's going to be a tough one for us, but I think we need to look at it. I think we need to have really, really, really defined financial issues come back to us, to the Board of Commissioners again. And I think we need to move it forward with that in mind. So we're very careful in our decision-making process.
Yeah. One second, and I just want to tag on to that because Patty hit something that I don't know we need to flesh out at this meeting, but I also question if we hire a new public health director and do we need 2 public health planners from the very beginning, or can we start with 1? So I'll leave that out there as a question that you can answer for me
Right,
later.
I had the same thought, because we're talking about phasing this in anyway, and so perhaps the way to do that is to phase in the staffing as well.
Right, and all of those things are up for grabs, great discussion items, and I think our feeling is the public health improvement plan has to happen next year, and that is a big chunk of work, and so that sort of defines a little bit about what we thought was a right size. But why don't we keep going, and then we can...
Yeah, just to finish that thought, because I was mentally going back and forth, well, with the obligations that person would have, they might turn around and tell us, well, we have to contract out a certain amount of that anyhow, and it'd be the same as hiring 2 people. So I don't know. I'm just putting it out there for discussion.
Right, and just remember, it's half a planner, amazingly. It's a very short person who's...
That's Patty?
Short is good. Short is good. We can afford
Powerfully
you.
packed. Okay, so let's move
so
on.
we talked about other funding, and we're not going to spend time here, but the Community Health Services has a fund balance. It is diminishing. And Healthy Community Fund, as the Board of County Commissioners knows, we have a fund balance of about $112,000. So those are potential funding sources, as is the general fund. Interesting, there are local grants that Community Health Services gets from the City of Aspen and Town of Snowmass Village and Basalt. That would take time with our partners to really determine, are they funding direct nursing, the clinical nursing services, or population health, and so that's why there's a question mark there. We don't know where that goes. As we said, the acting finance director and the county manager and I met, and we're proposing the use of the general fund for 2 years, and then beginning to blend and braid, George, just as you said, to absorb the costs fully in 2019. There are other things to consider, and we've had most of these people at the table, but there's technology, there's human resources, there's community relations needs, on the county side, fleet, attorney risk. So, while 3 people are not a lot, it's a capacity issue for everyone, and we recognize that. So we don't want to gloss over that part.
Where do we physically put them?
We have a slide there. Tried to think of everything.
So I'm just going to speak a little bit to the impacts of community health services, and most of which are obviously fiscal and staff and program specific. But as Dan mentioned early on, we made a request a year ago, a large request to the Healthy Community Fund that included expansion of our public health planners, adding a half-time public health planner, adding a half-time emergency preparedness coordinator, and to support the increasing costs of our clinical services. So we obviously didn't get that, but we got a slight increase. But that continued work has, at this point in mid-year 2000, $26,000. I have a $26,000 deficit just to the continued increased expenses and decreased income. So if we continue on this track, we could expect to see, exceed around $50,000 in a deficit by the end of this year, and that will be covered by our fund balance, which we've had for years, and we've always thought that it would be there for a true emergency and now we're having to use it for operating expenses.
Liz, what is your fund balance?
It's about $290,000 right now. So with the change of these grants, with shifting some of these grant funds in mid-2017 over to the Pitkin County, we stand to lose about $28,000 total, and that includes the cost savings that we would see with Jordana's salary being shifted over to the county for those 6 months of 2017. And for about the next year at least, we will still have all the expenses related to performing all the public health functions. So we will continue to operate as we are now at least through July of 2017. So we've determined that even if our funding remains static in 2017 with those changes, we could expect to see a deficit of about $150,000. And that would get our fund balance down by about 2/3. So in order to have a balanced budget for 2017, we will look at reducing clinical services and payroll and administrative services, which part of that, of course, makes sense because some of those functions will be shifting out of community health services. But the expenses related to operating the clinical services really don't change much. So the places where we can see making some changes would be in staffing and administrative expenses, benefits, and possibly changing how we offer clinical services.
Let me ask, as a nonprofit, you're obviously, I remember the changes to get the insurance reimbursement for certain services as people have those available, and then the Healthy Community Fund, and then other grants which you've been able to pursue and are successful at. Are there other nonprofit fundraising activities within the community like others have? Does your agency just flat out fundraise with, I don't know, Aspen Community Foundation requests and then other activities as a fundraising nonprofit?
As you know, historically we've never gotten into fundraising, but I think that's something the board's going to have to look at, possibly changing in the future. In my experience so far, I've found that many of those larger foundations want to fund these big community initiatives, as we spoke about, things that fall under the Aspen Community Foundation's Cradle to Career initiative. And not so much these direct services is the sense that I've gotten so far. Now, moving forward, I think we're going to have to look at every other opportunity to keep those direct services available.
Thank you.
Okay, potential space, Patty. we tried to think of everything, but I'm sure we didn't. What we've talked about is some potential remodels in the Schultz Health and Human Services building. You'll see here some ideas. CHS has a break room. No other organization in the Schultz building has a break room. That's a potential. We just had to it was painful to put everything on the table, but they have an annex across the hall. We could potentially, kind of switch people for space. And then there's potential for reorganizing some other building tenants. And, those are those are discussions, or offices that are not utilized fully. And we're really at a place now where we need to provide space for the critical services. So that's something to think about. Ultimately, we've looked at the idea of co-locating public health in 18 or 19, if there was an office in Basalt, and or potentially parts of community health services co-locating, which could free up some space. And then potentially the Eagle County building, the public health planner already has a space there. Yay, the half planner.
If they have a half a space.
Yeah, they already have half a space. Anyway, so those are ideas. We've just started brainstorming, but clearly space is really important. We don't think in the long run, at this point, although it could change, that environmental health would co-locate with public health, because they're in the design for the new building, and they're very well situated with community development. There are a lot of synergies that they don't want to lose with that, but they would be in the public health section. So we're almost done. How great is that, Liz?
So, moving forward, Healthy Community Fund grants for 2017 were due yesterday, but CHS got an extension till September 7th because of this process. So in the next month, CHS will be really looking at doing our budget presentation and presenting a budget to you in September at our budget meeting. Today is our joint meeting. We'll do our budget presentation to you on Tuesday, September 6th. Fall of 2016, looking at draft job descriptions, which Nan's already started, and we'd ideally like to start recruitment of the Public Health and Environment Director in the fall, and get that director hired in the first quarter of 2017, and then the second quarter get the public health planner transferred over to the county, possibly hire a second planner. And I wanted to just say something about that second planner, in terms of the work that's anticipated over the next year and completing our public health improvement plan. I had a year ago asked for a half-time planner to support Jordana in that work. So I think if you only start with one planner, there would be some capacity issues. Maybe the director has to step up and help out with that work. But I think that that we were going down the road of needing more capacity to do that, so that's just something to consider.
That's a good point. Thank you. Oh, Steve, sorry.
Liz, do you have a planner on your staff right now? Because this is implying we're transferring a position from CHS to the county.
Yes, Jordana Sabella is our public health planner.
So that's number one planner, and then when you talk about hiring a second one, that would be a new position, a newly created position.
Right.
Okay.
Thanks.
Thank you for clarifying.
Yes.
She's really a planner and a half, right?
She's the
Planner and three-quarter.
Yeah. She's going to have a really short one soon.
There we go.
So are we done with this one?
I think we said most everything.
This is duplicative, so, we're really feel that we have an extraordinary opportunity to act now to address systemic and structural problems with public health and environment, to strengthen what we already have in terms of the services that we have, provide a higher level of public health and environment to protection to the community, and set an example actually statewide for how to better respond to public health and environment threats in the community. And so through your discussion today, our hope is that we would find support to take this staffing proposal through the 2017 budget process with the county commissioners to see how it fares. How does it stack up with the other needs? Is it possible? Can we do this? Is this really what we need from the Board of Health? Do you all think this is the right thing to do? And give us some direction to move forward with it.
Okay, thank you. George?
Just back up a little question in terms of your budget for community health services. So first of all, are you on a partnership, a 3-year partnership with the Healthy Community Fund, or is it just an annual?
Not any longer. Last year, we ended our last 3-year partnership and are now doing annual applications.
And so as you're looking at your grant application for 2017, are you including, utilizing, or taking down your fund balance as part of that?
Yes.
Okay.
One thing to keep in mind as well is that while Community Health Services will complete a Healthy Community Fund grant application and present their budget to the Board of Health, we generally take your recommendations to the Citizen Grant Review Committee so they don't have to labor over it. We take your recommendations, and the Grant Review Committee is very grateful because it's so confusing to them. But whatever is decided on September 6th will be what the Healthy Community Fund supports.
Yeah, and it may be more of a question to the Community Health Services Board. I mean, I would encourage you to look at utilizing that fund balance. This is for a rainy day, and it's, it's raining, but it's in terms of long term, it's going to be able to separate these roles and responsibilities and resources. So rather than trying to get a larger hit from the Healthy Community Grant this year, utilize and use that fund balance to balance out the budget.
Yeah, I feel a little mixed on that myself. I wouldn't want to be in an agency that was going down 2/3 of what they used to have for the rainy day fund. I can see using some of it, certainly, but the transition may take longer than we anticipate, or again, should these, as it's possible, be the contractee in the future, they're going to want to have a healthy reserve fund to be able to fulfill that contract and to feel that they're in a good position to really pursue that contract. And so, I'm just saying I'm a little mixed. I'm not saying you should use all fund balance or as much as, and that's a decision to look through and things like that. Marky?
Liz, or the Board of Community Health Service, have you looked at a 5-year budget plan forecast with the change of services at Community Health Services? And if so, what's the viability of the program as it is, if you will, modified in terms of size and scope?
We haven't done that yet. I think a lot of our work will start once we get some direction, hopefully today, and how to move forward for 2017. But I think that we, just on this preliminary work that we've done, know that if our funding stays the same from the Healthy Community Fund for during this transition period, at the end of 2 years, we won't have a reserve at all. And so the future of those direct services and the viability of the organization would be in question even during this at the end of this transition period.
Absolutely. So I'd be very interested in looking at that from an overall community perspective and maintaining existing service. At the same time, I'm very supportive of doing the public health through Pitkin County. But one thing we can't afford to do as a community is let those services go.
Yeah, I agreed, fully agreed. Mary?
Oh, I was just going to say, I think part of what the Community Health Services Board has to do next, as soon as we know what it looks like, we know what the proposal looks like, is to determine what the resources are going to be moving forward. What kinds of services do we need to prioritize, and how do we'll move some resources around, be they human resources, be they benefits, be they whatever. And then I think it is a good idea. Then we're going to need to do that. Doing that exercise now is going to be a little more difficult until we know exactly what.
You don't know what you don't know yet.
We don't know what we don't know yet. That's right.
And I think it might be valuable during this transition to be able to potentially put a price tag on some of those things, because as Marky has said, these are essential services. We're going to move slowly and cautiously so that there aren't people or individuals falling through the cracks during that transition. And that's where it would be important to us as we make final decisions in budget to say, oh, well, we could keep one more day of services for X amount, or we can run a balanced budget with less services. You tell us where you would like us to go, just to a little bit of pricing so that, you could say, well, we can continue 3 vaccination clinics in the fall. If our funding is this and we can only do 2 if it's that, what do you guys want? And so that, we have an idea how to pull it together. Other comments or questions at this point? I think Ann, thank you.
The Public Health Act, that come with funding from state and just 2 grants? We'll
do this. Good luck.
A couple of questions. Basically, I'm very supportive of the proposal, and I talked to quite a few people in the room about it, so thank you for helping me understand what it is, especially the subject matter experts on the Board of Health. So one question, and this is to you, Nan. Do you see this split strengthening human services, helping you get more accomplished? We haven't talked a whole lot about that, but
yeah, we forgot that part. Yeah, absolutely. I mean, we're the passion that we've had about health, because community health was very busy in diligently providing the clinical services, has been exciting for us. But if we let that go, there's a whole bunch of areas that we need to pay attention to that I think Rachel started to bring up, and you'll hear at federal conferences, and the health conference at Keystone is really about how are we linking housing with eligibility, with public health, with mental health, with everything. And we need to be focused on those things, and we in human services we can't be if we're focused on managing the contract for community health services and all the other very exciting health landscape changes that are going on.
Okay, because I think that's a really important part of this discussion. The other, though, so $470,000 for the next 2 years, and the funding's been figured out by that, how to get that money, where that money's coming from. But I'm not clear on where the funding is going to come from after 2019.
That's the renewal of the Healthy Community Fund is the plan. So that similar to the way the senior services and the senior center is funded from the Healthy Community with a clear set aside, a certain percentage that they get. It's not, subject to whittling back and forth. That would have to be the funding. And so this really is dependent on a successful ballot question, I'd imagine.
Right, and also remember, we're looking at fully funding this for 2 years, but our experience is that human services, senior services, and public health should expect the county only pay about 30% at the most. That's the sort of the standard. It's actually less statewide. So that's where we're going, is that, yeah, we're paying up front the entire amount because we're trying to keep community health services whole. But as we move forward, the county pays, as best I can tell, about 19% of the human services budget. You pay about 38% of the senior services budget. All of the other money comes from state, federal, local grants. We bring in a ton of money. Public health will be the same. And so John just reminded me to share that we're not anticipating 100% funding forevermore. That would not be efficient. That wouldn't be best practice. That's not what other counties do. Thank you.
Yeah, and that's what I'm hearing, that it could be supplemented with grants and fundraising.
Right.
And some of it would be the insurance reimbursements.
Right, fees.
Fees for services.
Generally, but for public health depends on
it's not
where
much,
that is.
but it's. No. I just didn't want to leave it out.
And depending on, I don't think part of these recommendations did not include the county department taking on clinical services. So that insurance income would go to community health services.
Right.
Of it, remembering that the majority of the clients we serve are uninsured, and, so.
Yeah, exactly, Pat.
Yeah, I'm going to get back to the point that I've already made, but I'll do it quickly. I think we need to move it forward through the budget process. But again, I think everyone needs to keep in mind that we have granted there are pressing needs in the human health services departments of the county now. We wish we could do more, we wish we could do all of it, but we have those same needs pressing us from every department within the county. And so we only have a limited amount of dollars in our general fund that we can expend. So we, again, have to be very careful and very creative, which I think this plan is going to evolve to show us that there, with grants and federal and state funding, that we have to be including those in this picture very carefully as we move things forward.
Thank you. Well, we are in the discussion mode here. Questions and comments, concerns, omissions, additions. You've put everything up there. So, Liz, if you want to start, and then I'd really love to hear more from the Community Health Services Board.
Well, we had planned for Mary to, right after the Keystone recommendations, our board met and went through sort of an exercise where we discussed the strengths and concerns of the recommendations. And so Mary was going to summarize those for everyone here today.
Oh, great.
And then after that, hopefully we can have more discussion from everybody.
Okay, thank you.
Thanks, Mary.
You're welcome. Before I start, I would like to make a comment on what Patty just said, though, too. That came up the last time we met when we were meeting with Nan and Liz a couple weeks ago. And the importance, and I think that led to the slide, why are we here today? I think the importance of communicating to everybody, because yes, we might have to not fund something because we're building this, and as a county, as a community. And so I think it's really important. The communication piece of this is really going to be important, not just for community health services staff, which is hugely important, but for the county and for the community itself.
Yeah, thank you.
Yeah. Right after the recommendation was made, the Community Health Services Board met and we talked about what we saw as strengths and what we saw as challenges and opportunities as well. So when Nan asked me to do this, I just want to preface it by saying there are a lot of other board members here today, so if you have anything you want to add clarity to what I have to say or add anything that I might have missed, please do. We do see a lot of efficiencies in this, as Nan said before, on all of the functions that occur around health and human services and public health as well. So we really appreciated the broad strokes that Keystone brought to this, and really looking at not just what are we going to do about this relationship, and public health in general, but all the other functions as well that have to do with health. So we appreciated that. I think I can speak for the board to say that we think this is a good plan. This is a good thing for us to be doing. We really appreciate the Public Health Board, the new Public Health Board, and the Director of Public Health with a full complement of expertise. We think that's an important piece of this. Liz has talked to us often about how she feels she needs that assistance in terms of public health. The clarity in governance and funding, the clear line of authority for statutory requirements, public health needs, and the funding as well. We think this will really help with that. It allows CHS, or Community Health Services, to focus on the direct services that we provide, and it's been difficult to feel so pulled apart. And that gets back to the efficiency thing. And it'll allow us to operate as a nonprofit and not a quasi-government or county department. Not that we don't love the county, we do. No. But I think that's really taken a lot of energy, from everybody. The challenges, we would like to make sure that we're able to support the community health services and public health needs moving forward, not just financially, but in all ways. That there's a continuity of care, and I've heard that said a lot here today, so that's really important, that there's no break in services, that we're able to continue to provide that care, that the funding doesn't disappear before the responsibilities do, and that we have funding to provide into the future, whatever that looks like, because community health services, I hope, will be involved in helping the county and help decide what the future looks like for these direct services and where they go and how they're provided, because we're not about keeping community health services intact the way it is now just to do that. It's about, meeting the needs that exist. managing the disruption that this is going to cause for community health services, the board really wants to make sure they're able to do that for the staff and also for Liz. Continuing to provide services to a tri-county services the way we are now. The relationships that Liz has built are really important. And that there are opportunities, besides these all are opportunities in some ways, but also new sources for income for the nonprofit. I think that's really an important thing for us to be looking at, for the Community Health Services Board to be looking at. So did I miss anything, folks?
I think one other thing that we discussed as a group quite a bit was just our concern, and one of you articulated this earlier about Mountain Family currently being in flux, and where does that fit into this picture of continuity of services. And as we take some of this out of community health, but are also expecting some dependence on Mountain Family, that transition is going to be challenging because they are also in flux right now. So that was another point that we discussed.
Yes. That's a good point, and something we are aware of, and we're continuing to work with them and on that issue. So, George.
Sorry. I was just curious. I was wondering if Dr. Levine, if this makes your job easier or different, or.
I think it makes it more exciting. I strongly support all this effort and direction, and just feel that focus on public health and population health and is where the country's going and where we need to go, and disease prevention, health promotion. So I think it's exciting, and I want to continue to be a part of it and engaged in it. So I just think it will separate and be able to focus on forming a Department of Public Health and Environment, focusing on issues in a different way that are really needed, and separating tasks. So I think it's exciting.
Good, thanks.
Other comments? I would just say for myself, it's always a lot to get your arms around the human health and human services issues, and we've dealt over the years with a lot of confusion between mandated services and desirable services. And when we look at our valley, 72 nonprofits, which are part of the network of care. They're part of the fabric of our services. And so we've created this crazy quilt over the years, and some pieces are mandated and hold it together, and others are nice, bordered along the edge. And it just strikes me that it's the classic saying, although we don't really have people falling through the cracks now, I think we could do better, all of us, is if it's everybody's job, it's nobody's job. And we have this so now diversified that it's very hard to say whose exact responsibilities are for one thing. Or we can say it, but, for someone like Liz, I think about having three bosses, essentially. You have your board, you have our board as a BOCC, and our board as the Board of Health. And I just don't think that that's a tenable situation for anyone. And so I think that there comes a point where you have to realize that, a lot of our services, a lot of our community expectations are kind of growing up. There were different thoughts about what everything meant just 10 or 15 years ago in our community versus the standards and the level of care and the state expectations and public expectations are now. So I clearly see moving in this direction. Again, taking the time to make sure that we're not opening up cracks or letting anyone drop through the cracks, and then leaving it in a better place where I think that a lot of new initiatives and a lot of efforts can come out of that, a lot of success. So I'm very excited about it, and it's a question that I think could be answered later, and it's just totally for consideration of whether the new Board of Health, which I do believe should be focused dramatically more on expertise, on the expertise and people with expertise. But should we have a BOCC seat on that at all, just one seat for better, tighter liaison? or even honorarium seat. Maybe it's a non-voting seat or something. But, sometimes there's just a way that, and my example on that would be literally the Housing Authority. The city and the county both used to have a seat on the Housing Authority board, and now they don't. And it just seems to move you a little further away from knowing the inner workings and the challenges and being able to convey those to your fellow board members. So that's just the one point I'd put out there for consideration as we do structure that new board.
I think that was discussed, and it's a great point, and I think I support having a seat, county commissioner on the board, for that liaison, just for that reason.
Yeah.
And that's been discussed. I think Keystone actually recommended that as well.
Okay. Steve?
Yeah, as I remember in the Keystone recommendation, didn't they recommend 2 seats actually go to the BOCC members?
It was 1 or 2.
I can't remember.
Potentially 1 or 2, or a representative from Snowmass or Aspen. So
Yeah.
I think it was elected officials, but to clearly not dominate the
Absolutely.
board, right? So that would be a big change, and we spent a lot of time talking about that change with Keystone, and really we all came to conclude that that's a really good change in phase 3, but we need to build this structure first, and but we will keep that in mind, and you all will be part of deciding what it looks like.
Okay. So, George?
Yeah, I had another question. When I was looking through the Keystone report, at the very end, they talked about in the appendix the process they used and whom they interviewed. And it was a fairly extensive list, but what stood out in terms of who was missing on that list, and maybe it was done, but I didn't see AVH involved or Valley View involved, and I thought that seemed really odd to me.
It's observant, George.
That was not from lack of trying.
No.
I guess I don't get it.
There's no way to answer that other than there were attempts made, and the transition at AVH made it. The timing was just impossible. We were trying to get this done. They were in transition, and there was not an ability to meet.
Good question, George.
Yeah.
But George, I would say it's worth keeping trying because I think they do need to be at the table.
Yeah, absolutely.
I would agree with that.
Critical partners in the delivery of community health services.
Yeah.
Community health and public health.
All right, so I guess although there could be time for more questions if anyone has one, I'd just like to see kind of a nods ahead that this is the direction we'd all like to move in together. So
I'd like to see it come back as part of a very line-by-line budget proposal, because I think there's a lot of information that I need as a member of the Board of Commissioners as far as the fiscal responsibilities to the board, because that's a huge issue for us, and I think we need to be very careful, but I think it's something that is long past, and long term that we need to move it forward.
Thank you.
Okay.
I have a question, and
yes, please.
I know the answer to this list. I'm taking notes for Jeanette, which is only if there's action by the Board of Health. Do we need the Board of Health to make a motion to support us moving forward? John?
I will look to John for advice on that.
So as I read the direction that we're getting right now, it's more administrative direction to bring back a policy recommendation in the form of a budget. And so I think you can wait on formal action, but it'd be good to get a thumbs up or head nod.
Okay, everyone thumbs up who.
Formal that the.
You can go neutral if you want. We need to know what everybody's thinking. This is not a, so. Community health boards, you guys are supportive of where we're heading. Okay, great.
How does that work, John, in terms of logistically? Since the Board of Health would probably need to meet again this fall. For budget purposes?
There is a meeting.
There's a meeting scheduled?
Sorry. So from a governance perspective, how this would work is the Board of Health will develop a budget recommendation. That budget recommendation will come to the Board of County Commissioners, who should find no mystery in that recommendation.
You did look right at me.
I didn't mean to target you, Patty. It's just where my head was swiveling at the time. But at any rate, so how it'll work, and so if the Board of Health is reconstituted in a different manner in the future, that reconstituted Board of Health would be developing those recommended budgets. The appropriation authority rests with the Board of County Commissioners. And I think that's one of the areas that was a place of confusion historically. You know, is it the Grant Review Committee? Is it the Board of Commissioners? Was Community Health Services Board making that recommendation? And so that's how it will work. Obviously, with the how it's currently constituted, the commissioners' work will be easier once that recommendation comes.
Much easier.
So when we come on the September 6th to the Board of Health, it appears that we will have a community health services budget and continue to talk about the Pitkin County Public Health and Environment budget for your recommendation to move forward to the Board of County Commissioners. Strange, but true.
Okay. Do you have any other questions or direction from us today, Nan or Liz?
I guess I have a question about your budget process. I'm not that familiar with it. So by presenting the county's new public environmental health budget on the 6th, is that's part of your county budget process? Will that be, what will happen after
John,
that?
I'm going to leave you to answer this again most clearly, or Connie. Just come up to a microphone, please.
We're actually making this up as we go, because there is no precedent for this. No other county has done this.
We will need to build that into what we will be presenting to the commissioners for our general fund budget for 2017. And so as Patty has brought up, it does need to be brought into the complexity of the whole of the general fund and all of the different priorities that are weighting in. What is our fund balance, our resources, and bring the whole together. That will not be ready at the September 6th meeting. We've defined what we think a basic budget would be to start this public health section of the county for the first 2 years, 2017 and 18. And so we have an idea of that cost. The initial recommendation would be that cost for those 2 years not compete for revenue sources in the general fund, but come directly out of fund balance for that 2-year period as a startup cost. And what that does is it means that it won't be competing against law enforcement needs or public work needs or other needs of the general fund during that 2-year period. It gives time for the department to be up and running, a public health director there, other funding sources, so that we can get a better idea of then what the ongoing impact to the general fund will be. It might be a little bit difficult in this budget process to actually come up with the 5-year plan, since there are a lot of uncertainties. After that initial 2-year startup period, what will it look like? What will the funding level for the general fund be after that? That will still need some work. But it does need to be built into the whole of the general fund budget and presented to you. I believe it will be on October 14th this year.
Okay, and actually that is the general fund for a period of time, and with the anticipation of the Healthy Community Fund vote being after that.
Correct.
So again, it makes it hard on a 5-year plan.
As Connie was talking, I was thinking of requesting. It makes it very difficult for community health to come in with a budget on September 6th if they don't know that you support in concept the development of a public health department. So I think you all are in agreement of it. We're not likely going to be changing that budget very much for the public health and environment section. And really, on September 6th, we'll be focusing on the community health services budget from the Healthy Community Fund. Mm-hmm. And at that point, we will be asking the Board of Health for a vote of support to recommend to the county commissioners this funding.
Okay. Yes,
From the Healthy Community Fund and the general fund balance, both, right?
for the other activities.
For the other activities.
Yeah.
Okay.
Does that answer your question, Liz?
It does, and I guess I'm getting antsy and want to know at what point can we move forward with getting a position posted, and what's the cutoff, or what approval is necessary in order to actually start moving in this direction?
John?
So Liz isn't going to like this answer. Which means I'm going to have to stand right next to her when I give it. So I think what would make sense is the county has to present a proposed budget, or staff needs to present a proposed budget to the board no later than October 15th. We typically do that at a regularly scheduled work session before that date, and I can't remember what that is exactly. However, following that, we usually present an initial budget, and then we have a series of work sessions after that. I think we can't pay for the position until that budget is approved and properly appropriated by the board. I think I'd have a greater comfort level beginning recruitment with some integrity if we at least got through the work sessions with the board where that recommendation was covered and we got at least a conceptual approval to include that in our final budget resolution. And so we'd need to look at our calendar, but I would think that we could probably, if this moves along in that sequence, probably be in the November timeframe, Connie, that we'd
beginning of December.
have that work session. And if the board at that point is comfortable with the recommendations and is giving staff the direction to include it in the final budget, then I'd feel comfortable posting the position and having it ready for hire when the funds are appropriated. So.
And let me ask, though, just as a alternate path to that, because I'm anticipating it may take a period of time to really recruit and interview the right person. And with the settlement in the Valley, we all know how challenging that can be for folks who think they can afford it and get up here. Would it be, and this just for consideration, does not have to be answered now, but would it be possible for us to process a supplemental budget request to the 2016 budget so that we know that it's assured if we were able to hire them for some reason on December 15th, we don't have to wait for the 2017 budget to come through. So I'm just thinking, is there a way to jumpstart it that would have the authority to pay someone should we find them through a supplemental or something?
So you guys have different hats here as the Board of Health and as the Board of County Commissioners. And as the Board of Health, I would absolutely recommend that if you wanted to make that recommendation to the Board of Commissioners, you should do that. But as the Board of Commissioners and as your manager for the Board of Commissioners, I'd encourage you to wait to see what other priorities might be competing for those funds before you made that final commitment.
Okay.
How's that
Thank
for a
you for that.
convoluted
That works out real well. But I just wanted to see if there was alternates that, I'm sure everyone's antsy to know that, we're not going to spend the first 4 months or 5 months of 2017 with the position vacant.
And in terms of recruiting, if we're interviewing candidates and they ask me the question, hey, this was just approved for 2016, what's coming after? I want to be able to give a more definite answer for that recruitment process also.
Okay, thank you. So that does answer pretty much every question. Did anyone else have anything else that they've thought of? All I can do is express great thanks for everyone and for the tremendous service that our community has received for all these years. And again, I think there's a chance to raise your hand at any point in this process to say slow down or clarify or there's something we didn't think about yet, and try to make sure that I think we're all interested in a successful launch and a successful continuity of services throughout the community and improvements to those services as time goes by.
Great. you will need to make a motion, but I just want to thank Liz for her dedication as the public health director.
Oh.
The burden is really on her shoulders.
Yeah, no question about that. Nan, could you suggest a motion that you would like us to make?
I would like to suggest that you make a motion to adjourn the Board of Health meeting.
Okay, but you don't need a motion to pursue this direction or anything?
No,
okay, that's what I thought.
It's conceptual.
Okay, yeah, that's what I thought. That's why when you started saying a motion, I was wondering what you were...
Just a motion to close.
Okay. Is there a motion to adjourn the meeting? And is there a second?
Second.
Okay. All in favor signify by saying aye. 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 Any opposed? There are none. Thank you very much for your time this afternoon. We'll be meeting again. And we do have some birthday cake. I want to announce that it was Patty Clapper's birthday on Sunday. And we're not going to ask which one it is, but we're going to sing. Happy birthday to you. Happy birthday to you. Happy birthday, dear Patty. Happy birthday to you. You're welcome. Okay. So Grassroots, we're going to take a 15 minutes break if we can go off the air, and we'll serve up the cheesecake if anyone... Thank you very much. You have tuned into the Board of County Commissioners work session on Tuesday, August 2nd, and it is now time for us to review our future agenda calendars. Then we're going to have open discussion and some discussion on marijuana regulations. So, John, if you want to take us through future agendas.
I'm sorry, I was off my own roll there for a second. So, really what I want to focus on with you for future agendas is actually next week's meeting. Last week we talked about Gunnison County and the potential for a joint meeting there. There's some confusion over whether it had to do with the wild and scenic route from our meeting, our previous meeting, and I've had a chance to clarify that with Mike here. Gunnison County Commissioners are coming over to attend a meeting with the Marble Town Council on wild and scenic. That meeting starts at 7, and they'd like to be there obviously a little bit early to set up and such. A few of you had discussions when we were up there about the possibility of getting together to talk about some other items like the Crystal River Trail and our broadband initiative, those sorts of things. So Gunnison had reached out and offered to meet with us prior to them going to the Marble meeting to touch base on those issues. And so they'd be available from 4:30 to 6 to have dinner with us prior to their meeting with Marble. I've checked in with our staff from Open Space and Trails as well as in my office about availability to do some presentations and set up some conversations about both the Crystal River Trail, which that means something else to Gunnison County. I guess they have a Crystal River Trail
on their area.
Somewhere else too. As well as our broadband initiative in areas where we might partner in the future. The other thing that I talked to their manager about is they have just gone through the process of building a new courthouse, and so they're in their new courthouse now. It might be interesting to hear from their board's perspective and such, some lessons learned, since we are embarking on that journey now. So with that, that would require us to be out of here by 3 o'clock. There were some other items that were not on the future agendas. For example, the discussion of biodiversity policy and the open space and trails ballot language. So we're working right now to reform that whole agenda on the 9th. It could turn into a longish day with the trip to Redstone to visit with Gunnison County.
So, are you think we would have dinner in Redstone or in Marble?
I think Redstone.
Okay.
I'm thinking probably Redstone Inn would probably be the best place to meet.
Right. Okay.
So we talked about Redstone. That gives them a little bit of time. It's about a 20-25 minute drive back up to Marble and gives them some time to get settled in and such.
I'd like to go ahead and have the meeting if they're going to be over here. It's perfect timing. The staff's prepared to do the presentation.
Yeah, we're prepared to do the presentations, and like I said, to fit in the items that are not currently on your agenda, we're going to have some exec items also. We're probably going to have to squeeze some things and maybe move some things.
I think that having the biodiversity discussion is going to be critically important because on Wednesday the 10th we have our first reading of the potential ballot language. And so as much as I want to keep on track with our energy code addendum, that may be the item that we'd want to.
I don't know what you're talking about.
So, Patty, it's not shown on the August.
I have it on August 10th.
August 9th.
It's the second consent item. It's on mine.
But I don't see biodiversity. I see the reauthorization of
No. That's what we're saying. It's a work session on the 9th to discuss the biodiversity issues of the Open Space and Trails program because the ballot language is the following day for first reading on the 9th.
I didn't hear that at all. I just heard a discussion on biodiversity.
So,
that's a pretty broad range.
Sorry, Patty.
No, related to open space and trails management.
Yeah, so just to be clear, the Open Space and Trails Board started consideration of a biodiversity policy. That biodiversity policy addresses some issues that have been raised and that we had anticipated need to be addressed as we consider ballot language going forward. And so we would be bringing open space and trail staff in to both brief this board on, what's the history that's led to the biodiversity policy, what changes, and there's not actually a lot of changes to how we do things, it's codifying how we do things, and then follow that up with a brief discussion of the proposed ballot language before you guys consider it. So sorry for the confusion.
Yeah.
So the ninth is going to, I guess the upshot, that's a really long-winded way of me saying that with us adding, moving the Gunnison County and adding the biodiversity policy, and
we may end up with a working lunch or something like that.
It's going to be a longer day.
Yeah.
And I have another question on that day. What is the Open Space and Trails budget supplement? Do you know what that's specifically about?
I haven't seen the document come back to me yet, but if you walk on the third floor right now, Open Space and Trails still has all of their paper records lined on that wall. They've been working with BITS on a scanning proposal to get those scanned in, so it's part of that moving process.
Okay, great. Thank you. Anything else, John, that you have on future agendas for us?
Not at this point, although I probably should have some farther out.
Okay. I would just inform the board that when we get to Tuesday the 23rd, I have recommended to John that we have an hour and a half for the Snowmass Caucus formation request, not just an hour, so we'll be sure to have enough time for that. Yeah.
Who do purchase and use the medical marijuana are older, and in a one-stop shopping for them is probably easier with their specific health conditions.
Okay. Steve?
I would agree with changing the regulation along the lines that you said, Rachel. It makes sense. It makes it easier for especially an old person who it's probably maybe was hard for them in the first place to go to a marijuana dispensary.
Most of them, the first
then
time
if they
you
have
come
to
in
go
the
to
door.
another one that's more of a pot shop kind of a place where the atmosphere is probably different than yours.
It very much so is. We are a medical-only dispensary. Everyone has a medical card that comes in there, and they're all local residents. It's all, the occasional folks from Denver who are up visiting, that sort of thing, but I know all my patients on a first-name basis.
Okay. Thank you. Steve, were you finished?
Yeah.
Okay. George?
Maybe I missed something early on, I'm sorry, but right now, in the city limits, retail shops could sell paraphernalia.
Oh, yeah.
That's a question, and but it was a ordinance that we imposed in the county, no paraphernalia, whether it be retail or medical.
Correct.
So if we were to allow this for medical, are there any other establishments that would we need to open this up for retail as well, I guess is the question. And are there some establishments that sell retail and medical, and how would we differentiate?
Excuse me one second.
Actually, I'm sort of looking at our county attorney.
I'm sorry.
That's okay. No problem. No problem. Go ahead, John.
I guess I better sit up here. So, if we change the regulation to allow paraphernalia, whatever that paraphernalia might be, if you want to limit it and describe it or leave it open, we can make that change to affect medical only and not deal with retail and still leave the prohibition in effect with retail. If there are shops that are licensed for both, and to be honest with you, I can't remember if there are. Jeanette's shaking her head, so I don't believe there are. We don't have that dilemma. But typically speaking, at least under the medical or the Marijuana Enforcement Division state regulations, you have to segregate the marijuana product anyway, so there isn't that overlap, and you have the ability to segregate what's being sold. In the city, which is totally different than us, and we don't have to follow the city's lead or pick up anything that might be done in the city for consistency's purposes. But in the city, you can buy paraphernalia with your marijuana. In other words, the same one-stop shopping kind of thing. There is a division sometimes, but typically if the division exists, it's only to allow people in without going through the identification
the security
steps
screening.
before you access the part of the store where marijuana is being sold, as opposed to just buying hats and T-shirts and things like that.
Okay.
Can I?
Patty?
I don't believe I was on the board when this decision was made, so why was this decision made?
It was a concern that was shared by a couple of commissioners that, given that the enterprises were just starting, and this was a new endeavor for everybody concerned, the issue was, will the stores, particularly the retail outlets for medical or retail marijuana, generate a lot of foot traffic just with people going in and buying other stuff, bags of chips or something like that. And so it was thought by the board to limit traffic to just for marijuana products.
Yep.
So is there any reason we wouldn't consider just changing it for both retail or recreational and medical? Wouldn't it be easier?
Totally up to the board.
Because then if we have a retail, we don't really have any recreational. If we had one come in, and we might be going through this exercise again.
Yeah, I'd rather take them one at a time myself. This is the only request really in front of us. And I think that I'd have to really look back to see the tapes or something. But I think there was concern, which we see a lot of T-shirts that are, almost encouraging young people to start, and that here, let's go in and just get a T-shirt that's really cool about being high in the Rocky Mountains and this and that, as opposed to, look, if people want the marijuana, it's just like a liquor store, go in and get the liquor, but don't have it also have, everything in the sun and the moon to try to merchandise it. And we were just not that interested in seeing additional merchandising of the product, potentially to young people. Frisbees. And,
we didn't want it to be a 7-Eleven
yeah.
type of store.
I have no interest in that either.
Oh, I know you're not. But
Okay, then I would support just changing it to address the medical marijuana. I just wanted to know what the background was, because I wasn't sitting at the table then.
Yeah, and I think, John, we could probably define that as, and I think I heard the expression term of art a little earlier, the delivery devices necessary for different medical marijuana products.
State law defines what you're generally referring to, and I'd have to check that definition again. I haven't seen it in a little while, but I think that referring to the state definition will probably get us right where we want to be.
Okay. And we'll make sure that's kind of concurrent with the type of products necessary and being offered for people's medical conditions. I did read recently that the state of Colorado is marking a downtrend in opioid prescriptions that are being offered by doctors because people are choosing alternate pain control measures. So
I have 5 people a week come through my door looking to beat opiates and for something better. So
That's great.
I can concur with that.
I'm sorry, but did you say your shop was in Holland Hills?
Yes, sir.
Have you noticed any smells from other grow sites around Holland Hills? No, I'm just curious.
Not really. I mean, there's occasionally you'll catch a waft of something, and I'm a bad one to ask. I'm a little nose blind to it. I mean, I stand in a room full of it 8-10 hours a day, 7 days a week. So sometimes and I don't mean that to be joking or anything like that. I'm out, my wife, who's not really a smoker, we'll be out together and she'll smell it and I'll be like, no, I don't smell it at all, but that's...
Yeah, I'm just curious because that was an issue that came up recently in terms of smells coming from other grow sites besides High Country Farms, specifically in the Holland Hills area. So I was just...
Right.
And then you are growing at the Holland Hills location, aren't you? No, you received the product somewhere else.
No, we are, just our storefront is there.
Okay. And is there still a grow in the Holland Hills business
I believe so,
building?
yes.
Okay. Because that's also where we've seen the
nose
odor.
blind, because there is one in the building, so...
But it's not yours, because otherwise
ours.
I'd ask you to do some more odor mitigation.
About it. Yeah.
Okay. Any other board questions?
No, thanks for bringing it forward.
Thanks for bringing it forward. It'll probably take us a little time to process because of the public noticing times before changes like that take effect. And we'll have Jeanette notify you as soon as it's legal to be able to put things on the shelf.
Thank you so much.
Thank
I
you.
appreciate it.
Thank you.
Thanks.
Thank you.
Thanks for
And
coming in.
unrelated note, if you guys are looking for somewhere to eat in Marble, they have a really good barbecue.
Oh,
We know about that.
Throwing it out there.
Slow grooving. It's pretty
yeah,
good.
you got it.
They were at the mountain
Had it
fair
like
this
3
weekend
times
too.
this last couple weeks. Thank you.
All right, thanks, guys.
Yeah. Thank you so much. Okay, more open discussion items.
Yeah, I have 2 more items for you. First one is you did do an interview earlier today for the Grant Review Committee, Citizen Board, Martha Campbell. I don't know if I do not believe we have another applicant at this point, and we are coming up pretty closely on that review period.
I felt comfortable with the appointment. Do others want to appoint? Okay, there we go. So let's prepare a resolution for our next regular meeting, and we could go ahead and notify her as well that we're going to be doing that, so she can start her homework.
And then last thing I'd like to do is invite Rich Engelhardt up. I think all of you have had an opportunity to meet him at this point, but for the public's benefit, Rich is new to our staff this week. He's come on as our new Chief Operations Officer. And Rich, maybe you could tell us a little bit about yourself.
Well, thank you, John. I appreciate it. And commissioners, thank you. I arrived here 3 days ago, I believe now. So the fire hose has been flowing pretty full, but I got to tell you, I really enjoy working with the staff and what John's put in place here. I've had the opportunity during my research to watch you all in action, and I'm really excited to be a part of the organization. I was born in Gunnison, raised in Cortez, and then have spent my entire life in work life in Grand Junction and Delta. So I've got over 30 years of experience in local government. I've always been on the city side, so don't hold that against me. But anxious to certainly see the differences of what the county has to offer. Had great working relationships during those times with the county administrators. So I've been in Parks and Recreation is where my background is, and I've been an assistant manager and city manager in both Delta and Grand Junction. So I'm excited to be here. My wife and I were fortunate enough to find a place in Basalt rather quickly, and
Nice.
so we're renting there and just really are enjoying that. So
Very good, Patty.
So wait a minute. You were born in Gunnison, and you
Yes.
played ball for Mesa,
yeah, I
and you beat the Gunnison baseball team repeatedly.
repeatedly, and you might mention that to your husband.
I'm gonna. No, I didn't know the birth of that you were born in Gunny though.
Yeah, well, I didn't disclose that when I saw you yesterday.
Well, welcome aboard.
Thank you very much.
And do you have any questions for us?
I don't.
Well, you're here during a time when we're going to be in a lot of flux, as you've known, with the new facilities and temporary facilities. And, there's times when we're all hands on deck, and you look like an all hands on deck kind of person. So
We'll be there. You
okay.
betcha.
We really appreciate that, and thanks.
Great, thank
Well,
you.
and thank you again.
Okay. Other board members to open discussion items? Steve?
Just an announcement. I heard today that Mary Ann Dunn, Alamosa County Commissioner, passed away.
Yeah.
From cancer on July 24th, and that was in the CCI bulletin, the e-bulletin.
Yeah.
And I'd gotten to know her quite well at CCI meetings. She was there a lot when we were there.
John, is it possible that we could send a condolence card from the board, and track down who are the appropriate parties to send that to?
Yeah, that's a great.
That'd be
good
great.
idea.
And
That's a really good idea.
yeah, okay. Thanks. That's sad news. Let's see. Is there anything else I was trying to think of for open discussion items? If not, we'll just talk next week when we get together again. I really can't think of anything right now. Yeah, we have a joint meeting, but we're going to adjourn here.
Well, let me just tag on. I will I mentioned it earlier, but Steve, you were officially voted in at the COG meeting in Walden,
And they really liked the fact that we were appointing somebody to a committee who wasn't present in the room, as the old joke says. But I did tell them that you were approved by and supported by the Board of County Commissioners in Pitkin County. And so, yeah, and they were really excited to have you be part of the RAC because I know there's a meeting coming up. So perfect.
Very good.
Steve.
Very good. Okay, well, let's go ahead, I believe then, and adjourn this meeting, and we reconvene over at the city at 4 o'clock. So we have a little bit of free time, and that meeting is set to go from 4 to 5. We have our two items, the broadband service agreement. Information item is going to be Cozy Point Management Plan, process and timelines, and then potential future agenda items that we'd like to bring up. And so the two things I would like to bring up is that we would like to have a future discussion on edibles at some point and those sort of things. And you guys may have seen the article, I think I forwarded to John Peacock, maybe not the board, the Glenwood Post had today about off-highway vehicles that, it referenced pretty much the recent legislation that was passed, and Garfield County is now in a process of determining which county roads they will open for off-highway vehicle use. And so, as I've said before, I think that that's a decision and an issue that's going to be coming forward to us as well to begin that discussion. And it'd be nice to have at some point what our sheriff's office and others consider to be the current status of using county roads with off-highway vehicles, and we'll be taking a look at that. So that's something we should at least mention to the city as they're starting to have rental facilities for those, and I don't think they're just riding around the city streets. So, George?
Yeah, I think two other issues for future meetings for the city. One would be recycling as we're going into the budget. In terms of what we're going to be doing with the Rio Grande. And actually, John, I don't know what's ever happened with the Mid-Valley. I know we participated in keeping that open with BOCC, but was there any ending funding date for that at all?
There isn't one in BOCC.
No, the Mid-Valley.
The waste management one. George, I'm going to need to follow up. I know BOCC was looking to get out of fully funding this year. I think our agreement to come in at that 50% level, we had anticipated, we had budgeted for this year. It's really the Rio Grande that we have not reached agreement on. Right. So I get a status update on that. I don't know off the top of my head.
And then the other thing I think would be an interesting discussion with the city would be a presentation by the Senior Center for the Living Well initiative as their needs in terms of additional space continues to be an issue, and see if there's any opportunities that the city would like to participate in understanding what the needs are.
And I have one too.
Okay.
I had the opportunity yesterday to meet with the organizers of what's being called the Aspen City of Wellbeing. I thought it was a city program, but I researched it before I met with them. It is a data-driven nonprofit organization. Apparently they've met with Adam Frisch, and he's very excited about it. They met with Barry Crook, and he thought it should be a topic for joint discussion with the BOCC and the city. So I'm going to throw it out there. They're going for funding from the Healthy Community Fund. It's a whole different idea. I got a one-page thing. I just got a copy from Charlotte. I'll make copies to have at the meeting if anybody's interested in reading more about it.
I could be wrong, but it seemed like they might have applied to Healthy Communities last year.
They didn't mention last year.
I just want to say I could be wrong, but I remember kind of seeing something about it and a fairly big price tag to
the
get.
$100,000 to do a Gallup poll data survey. They're not looking for the total funding coming from Healthy Communities, but it's an interesting idea. Not quite sure, but they had been meeting with the city, so maybe, I'm not sure if the city will want to discuss it, but I told them I would throw it out there.
Okay.
And the only caution I throw out, and I should have caught this because you brought this up to me earlier, but in listening to it this time, the only caution I'd have is if they are planning on applying to the Healthy Community Fund, it may not be appropriate to give them a venue ahead of the other nonprofits in a joint meeting. Otherwise,
Yeah,
we
they'll
end
get a
up-
story in the paper and.
Well, it wouldn't be a
So-
joint meeting for months to come, the way we have our joint meetings, so
enough.
it'd probably be next summer.
Just so we can be aware of that.
Yeah.
Yeah, I think it's going to be really important to look at how does that work into the transition of the previous discussion we just had, with our health planner and community health and assessments. And, for me, it may be something that the planner or the half-time planner might want to contract them with, or they might want to do their own. But I'd hate to have two different health assessments going that are funded.
This is different than a health assessment. It's more complicated than that. But I'll run it by Adam before the meeting if I have a chance and see, because he actually met with them at greater length, and city staff has met with them, and maybe Barry Crook has some. He's the one who suggested it, so.
Okay, great. Okay, well, that's at least a lot of topics to touch base on. Okay, we'll adjourn the meeting and just be over at the City Hall a little before 4 o'clock. Thank you, Grassroots.